Okay, Dr. Hamza, I hope you are here. Let's just see your letter first so that we can see how things are going on. Okay. Yeah, okay. So if you see these things are okay, then dear Dr. Decoxia is fine. Bethany Taylor. I would say you have written that date of birth is not mentioned, but I would say there was age or date of birth. One should be mentioned. It is not possible that you won't get anything. Okay. If you go back and look at the case notes, you might find one. If not, they might send you that. Okay. But there should be a date of birth or age. Uh, okay. Then I'm writing to update you regarding Miss Taylor, who was admitted and treated for decompensated schizophrenia and is now ready to be discharged. Your further follow up and management would be highly appreciated. Very well written purpose, no problem. On this date, Ms. Taylor presented with the complaints of complaints of agitation, not agitated, okay? Agitation and aggressive behavior, thought blocking, latency, and not complying with medications. Moreover, see, now you have written he, so everything has changed. You have changed the gender quite successfully without any surgery, okay? Don't do that because if you not focus on this thing, they will focus on this thing a lot and they will do a surgery you won't like. Okay, Dr. Hamza, please, guys, this is something that I keep on emphasizing on daily basis. Do not mess things up with these he or she, okay? Because if you'll do, they will not like it and they will not pass you because Miss Taylor cannot be he. Okay, it is not possible. So, and everywhere you're writing he. Okay, so don't do that, please. Visual hallucination and delusions, therefore she was commenced from asperidone. Okay, rest of the things are fine. On this day, Miss Taylor reported seized auditory and visual hallucinations. Furthermore, he had, again, please, he not, there's no he, she had less disorganized thinking, no signs of thought blocking, and was able to minimize delusions. Hence, she was advised nursing management for. Okay, there is nothing that you advised her for nursing management. Her nursing management was done, okay, in the hospital. You didn't say, okay, I would like to advise you, please go and take some nursing management. Did you say that? No, you didn't, okay? Nursing management was there already. So it is not something that you would advise. It is already there. So her nursing management included, okay, uh, psychosis, delusions, and insurance of medical compliance. So this was something that nurses, you asked the nurses to do this, okay? Sorry about that. Okay. Here, rather than writing seized or auditory, okay, uh, if you want to write Miss Taylor and seized, then don't write reported. Just write on this date, Miss Taylor seized, okay, auditory and visual. I mean, she cannot seize by her own self, okay, but it's better that on this date, Miss Taylor reported improvement in her symptom as there were no auditory and visual hallucinations. Okay, remember we discussed that whenever something is not making sense to you or you're feeling, and you were feeling difficulty in writing this, therefore you have, you know, you have made an error here and you have cut that error and then you have written again. So I can see that if there is any difficulty that you're having, do not write the way you are thinking. Because if you are cutting it once and you're writing it another, then definitely you're making mistake. So change the way so that things will improve. Miss Taylor reported improvement in her symptoms as there were no auditory and visual hallucination. This is very fine way of writing. Okay. These things I've discussed. Nursing management included. Okay, a medical compliance, redirection. Okay, these are the words that were written in the case note. If you go back and see, okay, her nursing management included redirection from the psychosis or delusions, okay, and medical compliance. Okay, so mention that way, not the way you have written. This is not good. On assessment, Miss Taylor has good prognosis. When did you when have you done this assessment? Yesterday, tomorrow, day after tomorrow, 2009, 10 years ago, now, when? Okay, definitely you want to write today, right? Because you are discharging the patient. See that I told you guys that today is a magical word. If you won't write it, you won't get scores. And here you clearly have messed things up. Okay. On assessment, when this assessment was done, it happened in the past, it happened in the present, or you will do it in the future, or when? Okay. Mention it clearly. Today, today, she has showed good prognosis, or rather than that, she has showed satisfactory clinical recovery, and therefore she is now ready to be discharged. Her discharge plan includes risperidone 4 gram nightly. Nightly, daily, not good. Just write one thing. Okay, 4 gram per night daily. This is how you will write 4 gram nightly, daily. Okay, see, nightly, daily. There is no daily and actually. Okay. Risperidone 1 milligram twice. That is the reason I ask you guys, do not mention when to take, how to take, and okay, because you will make mistake. Now, nightly, daily, twice daily, PRN. This PRN, if they are mentioning to you in the case notes, you have to now translate this PRN. You can't just copy and paste PRN here, right? If required. Okay, if you won't translate it, well, then why you are writing a letter? Okay, they know what is the meaning of PRN. Okay, so there is, if you want to write PRNs exactly, then why would they write PRN there? Okay, you have to translate it. And what, how you translate it? If required for psychosis. Okay, but this page is very poorly written. Okay, the first page was very good. Again, I told you guys, if you'll try to be fancy, you will make mistakes, and you can see the results over here. In view of the above, Ms. Taylor is now discharged and referred to your clinic for further follow-up. In view of the above, I would be grateful if you could further take care of Mrs. Taylor accordingly. Simple line. Now, because you are writing a discharge letter, so at the end you are talking about referral, and it is not even a discharge, it is an update. Okay, because you are going to write the patient back to our GP. Okay, so at the end your discharge is fine, but again, if you're writing referral, then how many types of letters are you going to write in one letter? Discharge, update, and referral. Is that possible that there could be three types in one letter? Okay, so simple sentences are always good, will get you score, will get you a lot of positive outcome. Okay, things need to be improved, Dr. Hamza, please.